Jared here with Risk Management Advisors. Today we're going to revisit how we can save business owners 30% or more on their health insurance while simultaneously providing a better set of benefits to their employees. So today this is going to be business owner clients with 100 or more employees on the payroll, and then providing health insurance to those employees and their dependents. And why is this important? The reason is because this is expensive stuff. So after payroll, this is often the second largest expense for any given company. On average, it's $10,000 per employee to have them on your health insurance with their dependents, with their family. 100 employees, you're paying $1 million, 500, $5 million, so on. You get the idea. So this is a very large expenditure. And the sad truth is it keeps going up each and every year. So a long time ago, HMOs and PPOs, health maintenance organizations, preferred provider organizations, how most of us get our health insurance, became very popular, became the dominant way. And since that time, the costs have done nothing but skyrocket, gone up and up and up and up. And why is that? Well, the truth of the matter is that the health insurance companies actually have no incentive to reduce or control cost, okay? The more claims they pay out, the more they pay the hospitals or the providers, then the more money they get to, charge in terms of premium to the employer, to the business owner, and then therefore their profit margins, their share price goes up. Okay, so this model's broken, and it begs the question, what other aspect of our businesses are we still doing or buying, like it is the 90s, like it is, the early 2000s or the 80s even, dial up internet versus high-speed internet. We all have supercomputers in our hands, okay, versus picking up the telephone or using a fax machine even. But we still buy our benefits, HMOs and PPOs, like it's 1990. So it's an old, antiquated model. It's not the business owner's fault. It's that these health insurance companies have very big vested interests in keeping people doing exactly the same thing that they're doing, so they can continue to increase these costs year over year and make more and more money. But the truth is, there just like all the other aspects that I kind of alluded to, there's better ways out there. And so it's important we take a look at those and dig in and figure out how we can save money for the business owner and their employees. One concept is called reference-based pricing. The truth of the matter is hospitals out there, they set their own prices, and some charge a lot more than others, okay? And the health insurance come along and they'll negotiate with those hospitals, but at the end of the day, they're still paying out exorbitant amounts, more than needs to be paid out, more than is fair, to these hospitals, and then they turn around and they pass that cost on to the employer, while simultaneously that same hospital is taking much, much lower reimbursement rates or payment rates from other plans that are a little bit more savvy, folks that have evolved beyond the HMO, PPO, some of your competitors, Medicare and other payers. Okay, so they've got a spectrum of payments that they accept. In the health insurance models, they're bilking it for all that they can. So in the plans that we set up for our clients, we're using reference-based payments or direct contracting with these facilities and negotiating payments that are fair for everybody. And the results are staggering. Okay, so same grid as you saw before with costs going up, but the blue line here shows what happens when you adopt this type of model. Okay, costs immediately dropping down precipitously and continuing to go down year over year, sustainable savings, and then the employer, the business owner, is able to reinvest those savings into the plan, lower copays, better benefits for the employees, charge them less, save money. It's a much better model. It's a little bit different, again, because everybody's so used to doing what they're doing. HMOs, PPOs, that's the way it's done. But it doesn't have to be that way. There's new models evolving, and costs can be lowered. There can be better benefits, for everybody. If you're interested, or if this makes sense to you, give us a call. Risk Management Advisors, www.riskmgmtadvisors.com. Thank you.